Good day everyone! My name is Kyla Sula Manarang BSN2YA3. For today, I will be demonstrating to you the perineal care in the delivery room setting. But first, let me explain what is perineal care. Perineal care is the elimination of normal secretions and odors. This is also done to provide comfort for a patient in a delivery room setting, done in preparation for an expectant mother. The first thing I'm going to do is to introduce myself to the patient and explain the procedure. This is done to establish rapport, and it enhances cooperation and it reduces the patient's anxiety. Good day, Mrs. Dantes. My name is Kyla May S. Manarang and I am your student nurse for today. I'm going to perform the perineal care to you. Is that okay? Okay, great. For the materials and equipment, I will be needing a pitcher filled with betadine water solution, forceps, and the forceps holder. Betadine, cherry balls, trash receptacle, and a gauze, and a sterile perineal pad, a waterproof pad, and a bedpan or a bed pad. And also clean gloves. Next, I'm going to do hand hygiene, apply clean gloves, and follow standard precautions. Let's proceed to the perineal care proper. So now, I have applied my gloves. Before starting, I'm going to do a perineal flushing. And to do that, I'm going to pour a pitcher of betadine solution over the perineal area. But I'm going to inform the patient first that I'm going to pour this over her perineum. Why? Because this solution will tend to get cold, especially in an air-conditioned facility. So I'm going to inform the patient so she will not get surprised or feel discomfort and she will anticipate what I'm about to do to her. Mrs. Dantes, I'm going to pour this betadine water solution over your perineum and it might feel cold. Is that okay with you? Okay, thank you. So after doing the perineal flushing, I'm going to clean the perineum with a pre-soaked betadine gauze. So in doing this, I'm going to apply the principle of sterility. I'm going first to start with the least contamination, then I'm going to move on to the greatest contamination. For the first gauze, I'm going to do this on the top of the vulva, going over the mons pubis in a zigzag motion to cover all areas. Then I'm going to drop it after I use the first gauze. And for the second gauze, this will cover the labia majora and the inner thighs. Let us imagine that this gauze has two sides. The first side is for the labia majora and for the second side is for the inner thighs. In the first side, we are going to run through the labia majora. And the second side is for the inner thigh. Then after that, we're going to drop the gauze. Next, moving on to the third gauze, we're going to repeat the process. The labia majora, the first side, the second side is for the inner thigh. So I'm going to repeat the process. Labia majora, first side. Second side, inner thigh. For the fourth gauze, we're going to run this through the labia minora. We're going to collect secretions in the labia minora and this will facilitate bacterial growth. So we're going to start from top to bottom. Top to bottom. Then drop. We're gonna repeat on the other side for the fifth gauze. And then drop. And lastly, for the sixth gauze, this will run through all the orifices of the perineum, including anus, starting from the top of the vulva, passing through the urethral orifice, to the vaginal orifice, to the anus. And then drop. Return the forceps. Then I'm going to inform the patient that I have finished the procedure. And I will instruct her not to touch the perineal area because once she touches it, it will be contaminated again. Mrs. Dantes, I have finished your procedure. If you could, please don't touch your perineal area because it might get contaminated again once you touched it. Next, I'm going to remove my gloves. And do the aftercare. This is to promote sanitation and prevent environmental contamination. Then I'm going to document the procedure. This is to establish baseline data and to support the continuity of care. That is all for your perineal care in the delivery room setting. Once again, my name is Kyla May Sula Manarang, Dash 3 student nurse here at the prestigious Our Lady of Fatima University.